Catholic Care for Children is a sister-led movement that is animated by the charism of care, expressed by religious women and men, whose leadership is to reduce recourse to institutional care and to encourage family and community-based care for children. It began in 2014 in Zambia, Uganda in 2015, and Kenya in 2018.
My name is Sister Basilisa Namikoye, a little sister of St. Francis, working for OSK as the Executive Secretary. OSK as an association is an umbrella body of 158 members. The association's mission is to foster mutual support to congregations in terms of formation for authentic witness. Our vision is to be a dynamic association of women, religious, empowered, living gospel values. OSK started in 1962, and our main focus we have 5 strategic themes which we continue implementing as an association. We have different programs that run in the association: OSK Justice and Peace Commission, strengthening the capacity of women religious in early childhood development; OSK Chemichemi ya Uzima, where we run the formation programs, the catechetical programs, the integrated psycho-spiritual counseling program. As we started this program, having journeyed and discussed with the GHR Foundation in 2018, CCK program was born. We went ahead to do a baseline survey just to identify what are the gaps. And after doing our baseline survey in 2018 October, we identified so many gaps. We were able to start implementing the project, CCK, empowering the administrators, empowering the caretakers, empowering the congregations, the congregational leaders to understand more basically about the child protection policy. We have continued empowering the sisters. We are also moving towards helping congregations by ensuring that every CCI has a child protection policy and are compliant.
I am Sister Delphine Muhwana from the Congregation of the Daughters of the Heart of Mary. I am a project manager with Catholic Care of Children in Kenya, with the Association of Sisterhood of Kenya. Catholic Care for the Children is a movement that is in Uganda, Zambia, and Kenya. It aims at holistic family and community-based care. Catholic Care for Children approach has got 3 pillars, namely Catholic social teachings, the Word of God, and social sciences theories and the principles on care for children. CCC Kenya is a national movement operating in 24 Catholic dioceses. It has 133 childcare institutions with a total number of 10,799 children.
When we welcome the children in our institution, we are busy to collect the information, the OB number, the statement of the police, the report of health about the health of the children, and then to try to care them, but especially to focus the matter of the exit strategy, how to do for their future, because the institution is the last option.
Because of our association with CCC, I appeal especially to Catholic families to ensure that from now on, families will care for their children living with HIV, and a Uganda home will not be needed.
I tell the parents that it's what we see from them, how they interact with them, each other first. If you're my dad and every time you're quarreling my mother, you're abusing her, even when I'm old, that's the same thing I'm going to pretend. Then also, the parents should check on the friends the children work with. When you create a bond with the child, mtoto atakuwa so open kukuambia, so this is what nilifanyia hivi, things that you didn't even know, and you might be able to learn that this child sometimes might be heading towards a dangerous zone.
In summary, CCC upholds the principle that family is the best place for children to grow. If children are separated from their families, they are rescued and placed in charitable care institutions where they are accorded highest quality care in the shortest time possible. While children are being cared for, families are strengthened and prepared to receive the children back.
My name is Sister Lydia Pilibwor from the Little Sisters of Mary Immaculate of Gulu, serving as the Secretary General for the Association of Religious in Uganda, ARU, as it is always abbreviated. ARU was started in the year 1968, and it is an umbrella body that brings together all the major superiors of the institutes of consecrated persons in Uganda. The consecrated persons in Uganda come together to deliberate on issues of common concern. And one of the issues is the child protection and safeguarding, which gave birth to ARU CCCU in the year 2015. ARU CCCU came at the right time when Uganda had ratified to the United Nations Convention on the Rights of the Child, and also the African Charter on the Rights of the Child and the Welfare of the Child. And this gives the framework which guides the consecrated persons in the country in taking care of the children. With COVID-19, we are challenged, and most of the children in the child care homes have gone back to families. We have a responsibility to support the families economically, socially, morally, spiritually, and psychologically, so that they may be able to take care of the children, and that the children may grow in a family setting environment for the good of their future and the future of the world. Thank you.
I'm Sister Euphrasia Masika from the Institute of the Daughters of St. Teresa of the Child Jesus, and I'm the National Director of Catholic Care for Children in Uganda. The history of Catholic Care for Children in Uganda dates back to 2015 at the University of Notre Dame, where Kathleen Mahoney from GHR Foundation met Sister Margaret Kubanze and introduced to her the idea of how the religious could become champions of child protection and alternative care reforms in Uganda. Catholic Care for Children in Uganda program was born mainly to transition from institution care towards child growing up in safe, stable, and nurturing families or family-like environments. Catholic Care for Children in Uganda now works closely with 17 out of 112 religious institutes whose members are providing care for vulnerable children, including those with disabilities, in 44 residential care institutions, with a commitment to embrace more family and community-based approaches to the care of vulnerable children. The number of children or babies in residential institution care has considerably been reduced. We are now caring for over 700 children in family or family-like environment. We are winning hearts and minds of the religious and other stakeholders towards child protection and safeguarding practices through trainings. For instance, 280 priests, sisters, brothers, and superiors general have been trained in child protection and alternative care. We have developed a child protection safeguarding policy to guide our stakeholders in the care of children. 62 religious sisters and brothers have been trained in social work at all levels of higher education to get the required skills and knowledge. As such, all child care institutions under the care of the religious meet the standards of care, like they are all legally approved to operate. Gatekeeping, case management, and record keeping are all well managed. Sisters are emerging as champions in child care reform in Uganda. In doing all the above, the religious sisters and brothers are motivated by the words of Jesus in the Gospel according to St. Matthew, chapter 19, verse 13 to 14. Let the children come to me, do not stop them. I thank you all.
So Zambia Association of Sisterhood is a women religious association that is an umbrella body for all women religious congregations. It has a membership of 45 congregations, both indigenous and missionaries. And it has over 2,000 sisters. The association was founded in 1958. The association runs a number of spiritual, social, and developmental programs that are targeting the women religious, the lay faithful, the vulnerable, and the marginalized communities. Some of these are programs or projects that are running under the association are Catholic Care for Children in Zambia, which is CCCZ. We are building up capacity to religious women, training them in counseling and social work at degree level. We also have SCORE ECD, which is strengthening capacity of women religious in early childhood development. We also have the livelihood. Kalundu Study Center offers formation and leadership courses. And we also have ASEC, which is African Sisters Education Collaborative. This program, it gives education opportunities to African sisters.
Our project started in 2014 with 41 facilities on board. Our vision or our goal is to improve the well-being of children in Zambia by providing and promoting a long-term and positive family-like or family-based care and protection. We have 3 strategic objectives. 1, children stay in or return to their families. We want to see that the placement of children unnecessarily is reduced. To come up with community mechanisms and working with the Ministry of Social Services. Where possible, the child should not be admitted in the facility. And those who are already in the facility, we are working towards returning the child. The second objective is to empower facilities and us as an organization into the reintegration. We are doing this by training our facilities, our staff, in the reintegration guidelines provided by the government, and also in the minimum standards of care, in case management, and in other activities where they are lagging behind. We want also to see a system-level change through networking and advocacy as the third objective. We want to enhance our collaboration to reintegrate 200 children with the government and other partners in the country. Advocate for social protection for our children. We are also working closely among ourselves, share best practices, empower and learn from others, and by so doing, we are going to achieve our goal. Thank you.